Thank you for having me. My name is Deborah Thomas, and I'm delighted to be here tonight. This was an unexpected invitation, and I'll be honest with you, and speaking in front of hundreds of people wasn't an opportunity I jumped at very quickly. But here I am, standing in front of all of you, healthy, thankfully, happy, employed, and insured. You can see me, you can hear me, you're acknowledging I'm here, a thinking, breathing human being. Well, I'm going to tell you about a time when I was not seen or heard. A frightening time, a time when I needed most to be seen, heard, appreciated, and listened and cared for. A time when I was sick, needed care and attention, but didn't get it because I didn't have insurance. I remember that time clearly. I was in the doctor's office at a renowned Boston hospital, needing and wanting treatment by the best of the best, and about to be seen by a member of that elite group when I said I didn't have health insurance. At that moment, I became persona non grata. I saw their eyelids begin to close. I felt a seismic shift happening in my life. I was a person who had worked her entire adult life, paid my taxes, and now was not going to get cared for at a time when I needed it most. Because I was not insured, it knocked the wind out of me. I was confused, scared, and feeling alone. How did I get here to this unfamiliar place? What did I do wrong? It's like some sort of taboo not having insurance, not being part of an exclusive club. All of these thoughts and worries clouded my thinking, and that's wrong. I didn't do anything wrong. I just happened to not have health insurance. I wasn't a bad person. I do consider myself a savvy, educated person, and through the fog of disbelief and anxiety, I was able to speak up, research, and access the health insurance I needed, Commonwealth Care. Through the guidance of Kate Bisago, a counselor on the HelpLine at Healthcare for All. By the way, Kate was my lifeline. Thanks, Kate. I was able to navigate the complex system of signing up and then maintain my coverage with her continuous support. But what about those who can't speak up, who don't know how to use or have access to a computer, or the ability to do the research one needs to be informed and armed with knowledge, information, and power? I'm lucky because I can speak up, but what about those that can't? I've been insured with Commonwealth Care for almost 3 years now. At my age and at any age, having health insurance is one of the most beneficial things we can do for ourselves and each other. Yes, each other, because we are all in this together. I believe we need a shift in our thinking, as seismic as that day in the doctor's office. We need to change our thinking in this country. We need, for the good of our country, to educate providers and patients, insurers, and legislators, and come to the realization that health insurance is an inalienable right, and no one should be denied the coverage or the care they need. Healthcare reform is dire. We need to rethink how healthcare is accessed and delivered in our country, and that's not a quick fix. We're used to instant gratification. But a change in thinking and behavior is challenging work. It's work that goes on every day in our state through the work of Chapter 58, outreach workers, elected officials, providers, and consumers. Please continue this work any way you can, whether it's by becoming a better informed healthcare consumer or by supporting the HelpLine and the work at Healthcare for All. Thank you for inviting me this evening.
That was fantastic.
Thank you.
Look at you.